All right, today we're working with Jack, a 42-year-old male. He's got some symptoms consistent with cervical radiculopathy, left neck pain that's radiating down the arm, as well as some motor deficits in that arm as well. The symptoms were relieved when we distracted the cervical spine and aggravated when we compressed it. So we're going to see if we can do some mechanical traction with him today. Indications, there we go, for mechanical traction are disc herniation, and it does look like he's got a C5-6 disc herniation, so we'll be doing that there. Any other indications that he might be consistent with would be oh my goodness, where's my computer? Okay, would be some maybe nerve root impingement, and we're also going to for all the contraindications, acute sprains, strains, inflammation. He hurt this over the course of a while working in his garden, so it doesn't look like there's anything acute, but we'll check with him just to be sure. Fractures, joint instability, non-mechanical pain, stuff like that. Osteoporosis, osteopenia, or any prior surgeries, like we need to look out for, like stabilization or compression, implants, prosthetic discs, pulmonary and cardiovascular disease. And then one of the big ones we'll be looking out for is peripheralization of symptoms. Basically, the symptoms being further down that arm. We'll give him a kill switch in case he experiences them. So we'll go ahead and roll into the parameters. All right, so for our parameters, we're going to go here to cervical, anterior protocols for herniated disc. We usually do 20 to 30 minutes. It's his first time, so we do 15. We'll set the poundage at 20 to 30. We can adjust it here. So 20 to 30 pounds is what we're looking for. And we're wanting about 30 degrees. It's not going to say that right here just because he's not in the apparatus yet. So we're going to set it about 30 just because it's lower on the cervical spine. And then we're going to go into here. We're going to do manual. And we're going to do static. And then we'll go ahead and hit start when that poundage is ready and he's all hooked up. So we'll go ahead and roll into it. All right, Jack, how you doing today?
Doing okay. How are you doing?
I'm doing pretty good. My name's Dylan. I'm a student physical therapist with Rocky Mountain University. I'm working with Dr. Missy today.
Okay.
Today, the test that we did earlier kind of seems like you've got that pain that's radiating down your arm, that numbness down the arm that with the first two fingers here, and the pain in the neck.
Yeah.
You've got some symptoms that are consistent with a C5, C6 disc herniation, so it's like back in your neck here.
Okay.
And so something we'd like to try to kind of reduce those symptoms for you is what we call manual traction. Basically, it's just a little pull on your neck. Is that something you'd be comfortable in trying today?
I mean, if it helps reduce my symptoms and makes my neck feel better and my arm, yeah, I want to try it.
Okay, cool. We'll give it a shot, just to make sure that we clear a couple of red flags before we jump into treatment.
Okay.
We're just going to check to make sure. Do you have any like acute like sprains, strains, inflammation, fractures that you know about, like anything that's recent?
No.
Nothing? Okay. Do you have any pain that like isn't caused by neck movement, or like not non-mechanical pain is what we call it?
I don't think so, no.
Okay. Do you have osteoporosis or osteopenia at all? And then any vertebral joint instability, like spinal fusions or artificial discs or spinal implants, stuff like that?
No.
Okay, cool. Any cardiovascular or lung disease?
Nope.
Awesome. And then do you have any currently active cancer or DVT?
Nope.
And can you still feel along your spine here? Like, is there any reduced sensation?
Along my spine?
Along your spine, yeah. It's like, I know we've got that arm for you. But...
Yeah, for my arm, yeah, I did my arm, but like up here now.
Okay. All right, then we'll go ahead and get you set up. It looks like you're clear for that.
Okay.
Okay, perfect. So we're going to have you lay down just so that these bony parts just behind your ears are touching nice and guys right here.
Okay.
I'm going to twist this until it's firm but not uncomfortable, so let me know when.
About right there.
About right there?
Yep.
Perfect. I'm going to loop this around your head just right here.
Okay.
Perfect. Cinch that down. Is that comfortable for you?
Yeah.
Okay, perfect. I should have asked earlier, do you have any claustrophobia or anything like that? This would make worse.
Oh, no.
Okay.
No.
Sounds good. Let me go ahead and stick that there. All right. Then I'll hook you up here. Get about a 30-degree angle. All right. So before we get started on the treatment, it's a good demonstration of what we're about to do. So I've got a bell right here.
Okay.
If at any point it feels painful or uncomfortable, or most importantly, if your symptoms start moving down your arm, let me know.
Okay.
And the best way to do that is to ring the bell. So we'll leave that here with you. And then if it's painful, uncomfortable, or that starts moving, hit this button. This is the kill switch. It'll immediately stop treatment.
Okay.
So we'll go ahead and do that. So there's that for you.
Okay.
Okay. We'll go ahead and start with the parameters that we discussed earlier. This machine's broken, so we won't do it. So we'll go ahead and hit start. How's that feeling? Is it pulling good or?
Yeah, I can start to feel it pulling.
Starting to feel it
yeah,
pull.
it's just gradually getting stronger.
Okay, perfect. It's about 20 pounds, which is as strong as it's gonna get.
Okay.
So this is gonna just hold there for about 15 minutes. That'll help kind of relieve some of the pressure off that herniated disc. So I'll be back in about 10 minutes, and remember to ring that bell and hit the kill switch if you need anything.
Okay.
Yeah. All right. Treatment's over. How you feeling?
Oh, it feels great. Like I felt like I don't feel the numbness in my arm as much.
Oh, that's good. We like that. I'll go ahead and unhook your head first here. That's usually the... All right, we'll turn the machine off just to make sure nothing goes awry. Grab this guy and hook you here. All right, and I'll take the kill switch and the bell from you. You should be good to go. Is there anything else you want from me?
No, thank you.
All right. All right, let's get boogieing then.
Oh.